All right, and hello again to all of our cat advocates and our caregivers out there today, and welcome to our Basic Kitten Medical Issues webinar. Please note that today's webinar is the third in a four-part series titled Help, I Found a Kitten. My name is Brianna Lovell, Outreach and Events Associate at Alley Cat Allies. I am delighted to introduce today's session presented by our friends at Feline Outreach, Rescue, and Education, a nonprofit organization which provides training to shelters and rescues on increasing the survival rates of rescued kittens. We are joined today by the co-founders of Feline ORE, Susan Spalding and Rosemarie Crawford. Together, they have more than 40 years of experience caring for neonatal and sick kittens in shelters and as foster care providers. Along with other Feline ORE instructors, they teach classes around the country and present workshops at local and national conferences. Your speaker today is Rosemarie Crawford. Rosemarie is a licensed veterinary technician who has worked in both public and private shelters as a medical staff member and as a foster coordinator. She currently works in a large veterinary practice in Northern Virginia. Helping to moderate today's webinar and answer your questions is Susan Spalding. As we move through the webinar, please submit your questions using the questions panel. There is a lot of information to cover, and there are a lot of you out there listening. We will do our very best to answer as many questions as we can. If we are unable to answer your question today, just send an email to either Susan or Rosemarie via the address information provided during the presentation, and they will get back to you. You may also submit your questions directly to Alley Cat Allies by visiting www.alleycat.org/response. Just fill out our online form, which will connect you with the resources and information you need to help the cats in your community. Again, that link is www.alleycat.org/response. Just click on the Advice About Cats button to get started. Now, for just a bit of housekeeping. Number one, please note that you can hear us during this webinar, but we cannot hear you. Number two, this webinar is being recorded, and you'll be able to access and share the recorded version for free anytime by visiting www.alleycat.org/webinar. Lastly, but this is an important one, tomorrow or this evening you will receive a follow-up email with a link to a brief survey. Your feedback will be incredibly important as we continue to grow and develop new training opportunities for the future. So please keep an eye out for that survey and let us know what you think. So without further ado, let's send it over to Rosemarie and get started.
Well, hi everyone. Thank you, Brianna, for that nice introduction. Thank you everyone for joining us today. I hope you'll find the webinar informative and that you'll learn some new things. Thank you especially to Alley Cat Allies for making these webinars possible and for everything that they do for kittens and cats everywhere. Let's go ahead and get started. As we move through, again, if you have questions, Susan will be available. If we're not able to get to them, as Brianna said, we will do our best to follow up as soon as possible afterwards. Okay, a little bit about us. We are a nonprofit, all-volunteer group. Our main mission, as Brianna mentioned, is to provide information and training on feline care, particularly kittens, to shelters and rescues around the country. We develop educational materials, speak at conferences, and bring our workshops to locations, again, around the country where it's most needed and where there's an interest in finding out more. We are not a group that takes in or adopts out kittens. However, all of our volunteers regularly foster for community shelters and rescues where they live. And we often take the at-risk kittens, the bottle baby kittens, the ones who are sick. So we continually have lots of experience, maybe more than we want, on dealing with such kittens. Finally, we really work hard to promote cooperation and information sharing, especially between shelters and rescues. There are so many wonderful partnerships happening now where shelters and rescues are reaching out to each other to offer help to each other, to get help from each other. And we certainly encourage you to continue doing this if this is something you're already doing. Transferring animals out of the shelters to rescue groups, expanding your foster network by including rescue group fosters to help out these little neonatal and bottle baby kittens. A little bit of a disclaimer. Please understand that this presentation is for informational purposes only, and it's not intended to replace the professional veterinary care. We are going to be speaking a lot about protocols. We're going to be talking about some medications. But it really is important that you have some kind of established relationship with a veterinarian, with medical protocols, with your medical director in a shelter or a rescue organization. Prescription medications and even some non-prescription medications really should only be used under the direct supervision of a veterinarian and prescription of a veterinarian. Likewise, we encourage you to, when you're fostering these relationships with veterinary communities, to also respect that they do have limitations as well. Doctors, veterinarians cannot just prescribe medications without having an established relationship with a patient or a client. So be aware of that, and as much as we all have budgetary constraints and we all need to save money, they also do need to make a living, so they may not be able to provide every service for free. Okay, in the previous webinars, Susan did touch on some ideas about preventing illness and recognizing early signs of illness as a kind of a preview for what's coming up in this webinar. And it is really worth repeating. If we can prevent these kittens from becoming ill in the first place, then it's just going to work out better all the way around. It's going to be financially better for the shelter or rescue organization. It's obviously going to be better for the kitten if it doesn't get sick, and we can move more kittens through the system and hopefully find them their forever homes much more quickly. In preventing illnesses, we have to pay attention to quarantine and sanitation procedures, vaccination and preventative treatments, especially on intake. And early recognition of illness includes loss of appetite or lethargy. I mean, think about kittens. What kitten doesn't want to eat and what kitten doesn't want to play? Even bottle baby kittens, they are going to want to eat and they're going to kind of be content and they're going to go right back to sleep. If you see runny eyes, glassy eyes, nasal discharge, sneezing, and of course diarrhea and vomiting are certain signs that there's something going on health-wise with that kitten. Daily weight checks. We cannot say enough about daily weight checks. They really are a must. It's not something that you can just do when you have extra time. The lack of weight gain in a kitten or weight loss is often the first sign, and sometimes it's the only sign of an underlying illness. So please make sure that you're weighing these kittens every day. You're keeping a weight chart. You're keeping a weight chart and you're monitoring their weight, making sure that they're growing every day. You can get postage scales or food scales. We recommend digital scales for accuracy and ones that will weigh in tenths of ounces or grams. If you can catch a disease early, or if you can realize that there's a disease early and catch it and start treating it proactively, you can often shorten the duration of that disease and shorten the severity or lessen the severity of that disease as well. Okay, again, this is the third webinar in the series of 4, and again, please do access the first 2 webinars if you've not had a chance to join us for those. They are archived, as Brianna mentioned. You can get them through the Cat Allies website. In today's webinar, we're going to focus on what shelters around the country tell us and report as the most common kitten illnesses and most common kitten health issues that they have to deal with. And those include parasites, both internal and external parasites, diarrhea, and upper respiratory infections. For these, we're going to talk about the causes, about catching the symptoms, knowing what those symptoms are so you can catch them as soon as they start, and both prescription and non-prescription medications. At the end, we'll have a page of additional resources that you can access many additional websites for pretty much information on almost any kitten issue, certainly that we talk about today, and other kitten issues and questions that you may have. Sorry about that one. Okay, there we go. There's our slide. First of all, external parasites. The two main external parasites that we see with kittens are ear mites and fleas. So ear mites are really pretty easy to deal with. The kitten may show dark sandy debris in the ear if you take a little ear swab. They may or may not be itching at their ear or shaking their head. Sometimes it's the older cats that will do that. If you really like to have fun with diagnostics, I love diagnostics, so if you wanted to get an otoscope, you certainly can. There are inexpensive ones available online, and you can look in their little ears. The mites will kind of appear whitish, and sometimes when you first look in there with an otoscope, they stand still, and you just have to give it a moment or so, and then they start moving around again, and they're much easier to see when they're moving. You can also, if you chose and you like to have fun with microscopes, I know not every rescue or foster home has a microscope, obviously, but they can also be seen under a microscope very easily, and you'll see something like this little critter up here at the right. Now, of course, as I said, most shelters, rescues, foster parents do not have microscopes at their disposal, and what's becoming common is to basically treat for ear mites on intake or at some point in the time that those kittens are with you in the shelter or rescue organization. To treat those ear mites, there are lots of products available. There's prescription products, and there are more prescription products even than what I have listed here. Acrorex and Melbamite are two of those prescription products. Acrorex is a 0.01% ivermectin. And yes, there is ivermectin available at farm supply type stores, but realize that it may be a different concentration and you would have to adjust that. And even if it says for injection, you would not be injecting it, you would be using it topically. Now, if you want to avoid any problems with that, there's a wonderful over-the-counter medication, and no, we are not at all sponsored by Pfizer, but this is called Mitaclear, and it is manufactured by Pfizer, who's now called Zoetis for the animal section of their industry. And again, it's a non-prescription medication. It's specifically for treating ear mites, and it does a really excellent job. What we like about this, and what shelters and rescues who use this like about this, is that unlike some of the other non-prescription ear mite treatments that require treatment every day for 7 days or 14 days, this one requires only 2 dosing, 1 dose and then again once more 7 days later. Many places tell us, and it's been our experience as well, that often one treatment takes care of the problem, but certainly we recommend following the instruction label and doing that second treatment just to be sure, especially if you don't do a microscopic exam to make sure afterwards. Go ahead and do that second treatment. Okay, the other little bugger that we have to deal with kittens and external parasites are fleas. And fleas really are potentially life-threatening, especially to the little tiny baby kittens, the bottle baby kittens, or kittens that are already debilitated. They literally can suck the life out of them and can cause severe anemia issues. So we really have to get on top of the flea situation very quickly. Now, with the bottle baby kittens, we don't have too many chemical choices available to us, but bathing can go a long way to taking care of the problem and controlling it until the kitten is old enough to use some other chemical means. In webinar number 2, Susan gave some very good information about how to safely bathe young kittens. And again, just to reiterate, it's very important to keep them completely warm, keep them warm until completely dry, all the way down to the skin. And of course, kittens need to be kept warm anyway. Even regarding if they didn't have a bath, they still need to be kept warm. So you can access that webinar for more detailed information on bathing. Diatomaceous earth is an option that some places choose. Because of its powdery, dusty nature, though, be aware that there can be some irritation to the eyes or to the respiratory passages. And if you're noticing symptoms of irritated eyes or some respiratory issues or coughing, you'll probably want to discontinue using diatomaceous earth and give the kitten a good bath and remove the bedding that might have been treated with it. I'm going to jump over the topicals for a moment and go to the orals because Capstar, I mentioned with the bottle babies, a bath is probably your best option. But even on young kittens, even 4-week-old kittens, shelters are safely administering Capstar to kittens, and Capstar will very quickly kill the adult fleas, and then if you follow up with a bath to take care of the flea dirt and the flea eggs, the kitten is comfortable and you've gone a long way to eliminating the flea problem. And then when the kitten is older, it can receive a dosing of either a different topical or a different oral. Frontline Revolution Advantage for topicals. There's Program and Comfortis for oral medications. I do want to caution you on Advantix versus Advantage. Sadly, every year we get reports of people not being aware that there's a difference between those two products. And that Advantage, while that is okay, Advantix is toxic to felines. So please be aware of that yourself. Make others aware of that. People try to do the right thing. They think they're doing the right thing by applying Advantix, especially if they happen to also see a tick on the kitten. But it can become a life-threatening situation for the kitten. Likewise, in foster homes, if there are dogs that are on Advantix, please be aware that the kittens should be kept away from the dog and the product if there's any kind of mutual grooming that happens, so that they don't become, they're not ingesting any of the product, and being affected by it. Okay, finally on this page, I do want to talk about tapeworms. Fleas are carriers of tapeworms, and if you see fleas or flea debris, pretty much assume that the kitten is going to have tapeworms too. And to treat for the tapes as well. Oftentimes, tapeworms or tapeworm segments are not seen until several months later, so sometimes animals that don't appear to have a tapeworm problem are adopted out only to have the tapeworms discovered by their new owners. It's kind of, well, medically it's of course better that we treat the kittens, and many shelters and rescues are now including treatment for tapeworms at some point in their deworming schedule, and I'll talk about that a little bit later. But it's also really good PR. If you can take care of these easy things like ear mites and tapeworms, and you get a reputation in the community for adopting out really healthy animals, free of ear mites, free of tapeworms and other worms, that will go a long way for promoting your organization as well. Likewise, the negative information spreads. If you've got animals that go for their first vet visit and the vet's finding ear mites, and then later on tapes are seen, we want to make sure these animals stay in their forever homes, and the ick factor alone of seeing a tapeworm, tapeworm segment, especially when it's fresh and just came out, is often enough to make people bring a kitten back to the shelter or rescue and say, no, I don't want this, it's got parasites. So be aware of that and see if you can get tapeworm deworming in your protocol. Okay, certainly worms and tapeworms can be one of the causes of diarrhea, and I want to focus mostly on diarrhea and URIs for the rest of the time because they are so important, they are so prevalent, and they are potentially life-threatening. The younger the kitten, the more dangerous these illnesses are, and the more you have to be proactive and get on top of them right away. When there are signs of diarrhea, realize that when you start treating, even with supportive therapy, you're treating the symptom of the diarrhea, and you have to continue to look for what the cause of the diarrhea is so that that can be addressed as well. Weaning is a major cause of diarrhea in kittens between 3, 4, 4.5 weeks old. Again, in the second webinar, Susan talked more about weaning and some things you can do to lessen the chances of having diarrhea at that stage. Illness, many illnesses, diarrhea is a symptom of many illnesses, and it might be difficult to find out exactly which illness it is at first, but continue to find the cause so that you can address it. Parasitic and bacterial illnesses we'll talk about in a little bit. Medications can cause diarrhea. Certain antibiotics are a little bit more prone to it than others. Realize that the antibiotic is not only killing the bad bacteria, but also the good bacteria that lives in the GI tract. Dewormers. If you have a kitten that has pretty decent stool and it gets a dewormer and the next day it's a little bit loose stool, you don't probably have to panic too much, but definitely keep an eye on it and make sure that the next day that stool is back to normal again. If it's not, you need to continue to look further to see what the cause of that diarrhea is. Environmental stressors. This can be so many things. I mean, even weaning can kind of fit under that. We don't think weaning is a very stressful thing. I mean, you're just going from a bottle to some wet food, you know, big deal. But for a kitten, it is. It's a different food in their system. It's a different way of eating. And likewise, when you move kittens around, either within a shelter location to a different room, or from a shelter to a foster environment, or from one foster to another, or when the kitten maybe is going to one of the adoption facility outlets. These are all stressful things, these changes of location, and it can cause diarrhea, and we're going to want to, you can even try to treat a little bit ahead of time by adding in Fortiflora and some probiotics that we'll talk about in a little bit to help prevent a really bad case of diarrhea because of these stresses. Overcrowding is definitely a stressor for kittens, either within a single cage or within a facility. And it's also a major source of transmission of disease. The more animals you have in the smaller amount of space for them, the more likely it is, the easier it is for them to transmit diseases to each other. So definitely try to have proper sized cages. Don't put too many kittens in one cage. We recommend if you get a litter, for example, of 6 kittens, if at all possible, break that litter up into 2 litters of 3, or even better, 3 litters of 2. And again, that's going to depend on your cage space. It's going to depend on if you're sending them out to fosters and you have enough fosters available. But when you make the litter a little bit smaller, you're also reducing the risk of all 6 kittens getting sick. If one kitten gets sick and it's only living with 1 or 2 other kittens, you've minimized the spread of that even further, and now maybe only 2 or 3 are sick instead of 6. Sight, sounds, and smells. There are all kinds of things even in foster homes and in shelters that can be triggers of stress. Music, loud noises, banging cages. Imagine, you know, you're drifting off to sleep and cages are banging, or loud music gets turned on. And even places that play soft music or classical music, there really needs to be a time also that the music is also turned off. At nighttime, turn off the lights, turn off the music, let their little brains just have no outside stimulus. Some smells like citrus, especially is a smell that cats and kittens don't really like. Be aware of air fresheners. So sometimes if you walk into a room where air freshener has just been sprayed, it makes us cough. Imagine how the little kittens feel as well, and what that may be doing, affecting their lungs. And possibly irritating them. GI obstructions, you may still see diarrhea because the liquid portion can still get through past the obstruction. With this, I mentioned that specifically to be aware of what kinds of toys are available for the kitten, especially when they're unsupervised and the toys that are left in the cage. No ribbons, no string, no yarn. All of these things can be very bad if they get ingested. Likewise, if there are toys with stuffing, make sure the stuffing is not coming out, and be aware of what's in their cage. Towels and bedding, make sure there's no frays and loose strings on those as well. And then also dietary reasons are a major cause for diarrhea. And although I put this at the last part on the slide, it may be actually one of the most common reasons for diarrhea, and I'm going to spend the whole slide on that. So here's a little guy. This picture I just have to love because this was a kitten who was sick, who was not eating, and this is when he finally decided that, wow, I can eat again. He was feeling better to eat, and anyone who knows me knows that during the weaning stage, kittens make me crazy because they get food all over them. And but this one made me smile and laugh because I knew he was starting to feel better. when you're changing any kind of food, whether it be from a bottle to wet food, if it's a different brand of food, even sometimes different flavors of food can cause some loose stool and stomach upset. So any changes should be done gradually if you're changing from one food to another. Sometimes even formula with neonatal kittens from one brand, from like KMR to GNC or some of the other brands that are available, that can cause a problem. Sometimes even going from the canned KMR to the powdered KMR might be enough to cause a problem. Susan also talked about in the first webinar the concentration of formula, and if the formula is too rich, it can cause problems for the kitten. Think about how we feel if we go out to dinner and we have a really rich meal that we're not used to having, and how we feel and sometimes what that does to us afterwards. It can be the same situation when there's too much formula to water ratio. So if there's some loose stool, you want to pull back on the amount of formula. You want to make it a little bit less rich and add a little bit more water. And again, please visit our first webinar that will tell you more about this particularly. Overfeeding. Kittens love to eat, and we love to see kittens eat. But unfortunately, sometimes we love to see kittens eat so much that we just keep giving them food. Oh, he's still eating, so he must be hungry. Well, kittens sometimes don't stop eating. They will just eat and eat and eat until their bellies are so full. And again, think about how you feel if you've eaten too much. You just had one helping too much and how uncomfortable you are. And again, what that can do for your gastrointestinal tract. The same thing happens with kittens. So we need to do the tough love. We need to say, okay, you're getting enough food for what you need. Again, we're weighing kittens every single day, so we're seeing that the kittens are still gaining weight, so they're getting enough food. But we need to be the ones to say, okay, this is the amount of food that you should have. Feed them a little bit less, or maybe spread out the feedings to be a little less often. This is also true with bottle babies. When they're younger, they're having to eat every 2 or 3 hours, and as they get older, this time period needs to increase as well. And oftentimes, just feeding a little less or a little less often is going to solve the problem. Deficient probiotics can happen again, especially like with antibiotics. It's killing the good flora as well. Deficient enzymes, cow's milk. Don't feed cow's milk, but also I say this because when you get kittens into your shelter or rescue, the person who found them or is bringing them in might have given the kitten some milk to drink. They might not have any kitten food at home. They think, oh, kittens like milk, let's give them some milk, and they do like milk, but it's going to cause them some dietary problems, some loose stool. So find out from the people who bring the kittens in, have you fed them anything? Have you given them anything to drink? And find out as much as you can. So if there's an issue on the next day, you can hopefully say, okay, well, yeah, this kitten drank a big bowl of milk, and maybe that's why we're having the diarrhea. Some ways to remedy this. Again, we talked about adjusting the feeding schedule or the amount. You can choose a diet that's easier to digest, like ID or EN. Of course, we have to consider budgets, though, and these are a little bit more expensive prescription medication or prescription foods. So other things like choosing a chicken or a turkey-based meal rather than something that's fish-based or has extra fat in it will help out. Add extra water or electrolyte solution, and this is important. It doesn't solve the diarrhea, but it will help prevent dehydration and electrolyte imbalances that might happen because of the diarrhea. You can put extra bowls of water in the cage, an actual bowl of Pedialyte, and sometimes the kittens will actually prefer the Pedialyte over the regular water. And if you have an additional bowl in there, if they're old enough to be able to drink from a bowl, sometimes they'll wander around their cage and they'll just see a bowl of water and like, oh, hey, a bowl of water. And having extra in the cage encourages them to drink more water just because they find it more often. There are supplements that you can add to the food as needed, rice cereal or even cooked rice that you do yourself, pumpkin or squash, and this could be the baby food jars or the packed pumpkin that you use to make pumpkin pies. Just make sure there's no spices in it. And then probiotics like Fortiflora and Benebac. Some bacterial and parasitic causes, again, worms, roundworms are by far the most common that we see in kittens. There are protozoa that can cause diarrhea, coccidia and giardia being the main ones, and there are lots of bacteria that can have an overgrowth in their intestines. Clostridia and spirochetes are pretty common. The reason I have this here is to explain the difference quickly about fecal exams. A standard fecal exam often includes only what's called a fecal float, and that fecal float will not look specifically for bacteria and for some protozoa like giardia. Those are more easily found on what's called a direct exam, a direct fecal exam, or a smear fecal exam. Giardia, there are also SNAP tests available. It breaks my heart when I know there are rescue organizations that they have to be budget conscious, as we all do, and they're trying to do the right thing for kittens, and they bring in a fecal sample because there's diarrhea, and they tell us, well, I brought in a fecal sample and it was no parasites seen, but he's still having diarrhea, so I brought in another fecal sample and another fecal sample, and they'll sometimes spend money on 3 or 4 fecal samples, and they're doing the same test every time, when in fact adding this other test, a smear or a direct exam, can often find the problem. Okay, worms, they're pretty easy to treat, actually. Again, roundworms are going to be the most common, but roundworms and hookworms are both treatable with pyrantel pamoate. The brand name is Strongid. You can begin and should begin treatment as early as 2 weeks of age, and then go ahead and continue treating every 2 weeks. Some protocols suggest every week. But the important thing is that it has to be done at a proper interval. The first dosing kills the adult worms, and then there's still eggs in the intestine. So the next dosing has to catch the new worms after they've hatched, but before they're old enough to produce eggs from themselves. You can confirm with a fecal test, but again, many organizations just treat as a matter of course, and treat every 2 weeks is a common duration, or a common schedule. Drontal and Droncit are for tapeworms especially. Drontal also treats the roundworms and hookworms, and the benefit of treating tapeworms also. Drontal, unfortunately, is a little bit expensive, so what we recommend doing, and what many organizations do, is they will treat for the tapeworm when the kitten is like 6 or 7 weeks old. At this point, they're under 2 pounds, and the dosing for the Drontal is about 1/4 of a tablet. So your bottle of Drontal can go a long way to treating a lot of kittens. If you choose, you can use Droncit, which will treat the tapeworms, and continue to use the pyrantel to treat the roundworms and hookworms. Often one treatment is enough for tapeworms, but sometimes if tapeworms are seen and you know it's a bad case of it, sometimes two treatments are needed. Other intestinal protozoa, coccidia, often has a yellowish soft stool. Sometimes there's mucus, sometimes there's blood, and it has a very characteristic odor. But sometimes you can actually have a kitten with perfect stool, and you think, well, it's not a diarrhea issue, it's not coccidia because the stool is perfect. But really, sometimes it can be coccidia. Sometimes when there's a bad case of coccidia, kittens also don't want to eat. So if possible, go ahead and do a fecal, and a float should be able to catch the coccidia to rule out that as a problem. It is treatable with Albon and or Panazrol, and there are so many possible ways of treating this. I wouldn't even want to tell you a protocol that is most common, because some groups will use only Albon, some groups will only use Panazrol, some will use a combination of them. With each medication, they treat coccidia, either controlling it or killing it, and Albon tends to take is more treatments, but it's less expensive. Panazrol is a little bit more expensive, but it takes fewer treatments, so in the end it may come out more even. And there are ways to treat using both, maybe using panazeral for the first dose and then continuing with Albon. So this is something that you'll need to work out within your organization for your protocol. And with coccidia, it may also depend on the individual kitten and how bad the case is, which medication you might choose to use there. Giardia it's often difficult to find on a fecal exam because of the way its life cycle is. There are SNAP tests as well, as I've mentioned. Many organizations and some veterinarians will go ahead and treat symptomatically if other treatments and causes have been ruled out. There are some age and weight restrictions with metronidazole, so just be aware of that, and some side effects that could be neurological, but if you notice them and you stop or change the treatment, again, check with your veterinarian. Those should not be lasting side effects. There are tons of different bacteria that can cause diarrhea issues. Again, Clostridium spirochetes are two of the common ones, and these are ones that are going to be found by a smear rather than the float, and prescription antibiotics will take care of those pretty easily. As soon as you see diarrhea, it's really important to start with supportive therapies. Start with the extra fluids, add water into the food, again, put that extra water bowl out. Include probiotics like Fortiflora or Benebac, or even plain yogurt, vanilla or plain flavored. I have a kitty at home. He actually loves strawberry flavored yogurt. Just be careful that it's actually just normal yogurt. It doesn't have the fake sweeteners in it. Rice cereal and cooked rice are very effective. For the tiny kittens, you might want to run the cooked rice through a ricer to make it finer and even easier to digest. Pumpkin or squash again. And Diagel, it used to be called VBG gel. It's an all-natural ingredient that really has some quite good effects against diarrhea. My caution, oops, I didn't mean to do that. My caution is to do not use human anti-diarrheal medications. They often change their recipes, and sometimes what used to be safe is no longer safe, and they contain harmful ingredients to cats, bismuth being one of them. So that pink substance that we sometimes use as humans is something we definitely do not want to use with cats and kittens. Okay, let's move on to upper respiratory infections. Many causes, but by far the most common are viral. And of those viruses causing upper respiratory infections, there's rhino and caleci. If you've heard about kitties with herpes virus, that's the rhinovirus. Bacterial infections are a little less common, but it can include chlamydia, and fungal infections are also possible. Regardless of the cause, many of the symptoms are the same, which include ocular discharge, conjunctivitis or the swelling around the tissue around the eyes, nasal discharge, sneezing, lack of appetite. Sometimes there will be a fever and lethargy as well. This is little Monroe. I'll tell you about him later. In addition to those symptoms, the caleci virus has symptoms that are associated with it. These symptoms don't always have to be present with caleci, but they often are. And those include tongue or mouth ulcers and arthritis. If you see this kitten on the right, how red the edges are here and kind of smooth, this is one type of ulcer that can happen with the tongues, or they can actually be like blister ulcers, like skin burns or sunburns. And imagine having that on your tongue and how much that would hurt. And so what typically happens is these kittens stop eating or they eat less, and we really need to make sure that kittens continue to eat. It's going to prevent a whole other realm of situations. If you can keep them eating, it's a good thing. Arthritis is the other thing. The good thing, if there can be something good about it, is that it is transient. And it's usually self-limiting. So it may last 2 to 4 days, and it can affect any joint within the kitten's body. I've seen it in spines and hips and jaws. So the kittens aren't going to want to get up to move to the food and get to their food. So during this time, please bring the food to them. Hopefully they're in nice big cages where their litter box is at way end, and they have way at one end, and there's plenty of room for sleeping and playing, and there's food way far away from the litter box. But bring the food to them at this point. until they get past this. The herpes virus, often there are severe eye issues or ongoing eye issues that are associated with it. And some people use L-lysine on an ongoing situation. There's some studies recently that say that maybe it's not as effective in a shelter environment, but other people still swear by it, so you can make your own decisions about that. The thing is, we need to prevent these URIs from progressing into pneumonia, in which case we would need much stronger antibiotics and additional therapies. It's going to take longer to get the kitten well again, nebulizing treatments, and that could be a webinar in and of itself, and unfortunately we don't have time for all of that today about pneumonia, so let's find out what we can do to just prevent it from becoming pneumonia and take care of the URIs as quickly as we can. So as soon as you see any ocular or nasal discharge, start making sure their face is wiped off and kept clean. It helps them be more comfortable, they're better able to smell their food, and then they tend to keep eating better. Feed them appetizing food. This is one time where, even though we say chicken is nicer for kittens, that you might want to consider fish if they're starting not to eat. Pick a smellier food. Sometimes warming that food up will help the aroma to escape a little bit better and be more enticing to the kitten. You can add in baby food. Either chicken or turkey flavor is good. I just caution you, make sure it's not the chicken dinner that has the peas and the carrots and the onions. Onions are actually bad for cats and kittens. You can add the baby food into canned food. You can do it just individually for a few days. Supplement with NutriCal. If they're not eating the volume of food they need, they're going to need to have a more packed nutrition in a smaller amount of volume. So NutriCal will give those extra calories and nutrients without having to increase the volume of what they're eating. And you can actually feed the kittens NutriCal via syringe. Go ahead and dilute it a little bit with water because it's very pasty. It's like peanut butter in their mouth, and it's harder to swallow. So if you dilute it with a little bit of water, we've had kittens who are able to survive for a week or 10 days even, especially like Panluke kittens who can't keep very much down, so you can only feed them a little bit of NutriCal at a time. Again, you're going to be weighing the kittens. It is possible that when they're sick that they might not be gaining weight, but you certainly don't want to see a reduction in weight. You don't want to see any weight loss. So if you're starting to see the weight not going up anymore, or certainly if it's starting to go down, then you certainly need to add some NutriCal or supplement like that. Watch for dehydration. Again, extra bowls of water, just like with diarrhea. And administering of sub-Q fluids. This is really, really an important skill for staff and for foster parents to know how to do. It's not difficult, and it really is a life-saving procedure for kittens. You can't let them get dehydrated, and if it's 2 in the morning, it prevents having to go to an emergency room clinic if you can administer sub-Q fluids at home. Seek veterinary consult, or with your medical director at the shelter or your rescue organization, whatever your protocols are. Don't wait until things get bad. Be proactive. Keep very good records of symptoms, of weights, dates that things happened, what the symptoms were like, what kind of treatments you've given, even if it's the non-prescription and just supportive treatments. There are prescription treatments available. Again, don't wait until things get bad. Antibiotics, we always get the question, and many vets get the question, well, if it's a viral infection, antibiotics don't do any good. But actually in young kittens, it's very important that they have antibiotics because of secondary bacterial infections. Even with many viral upper respiratory infections, there are secondary infections of bacteria present. And these tiny little kittens don't have a fully developed immune system yet. Their little bodies are working as hard as they can to fight off the viral infection. We need to help them out with some antibiotics to help either prevent or to take care of any secondary bacterial infections. And many times in necropsies and in studies, it's found that kittens aren't necessarily dying from a viral infection, but from the secondary bacterial infections and the complications and sepsis sepsis even. So help them out with some antibiotics. These are some common ones: Clavamox, Baytril, doxycycline. Yes, each one of these has some pros and cons to them. There are others, plenty of other antibiotics available. Amoxicillin, injectable penicillin is being used by many places now. Azithromycin or Zithromax is another one. There are a lot of antibiotics to choose from, and this is something that, working with a veterinarian and consulting with the medical director, you can come up with a protocol that's going to work for your budget and your staff and your physical plant and the number of kittens that you get. Eye medications are listed here because often with upper respiratory infections there's eye infections as well. Triple antibiotic ointments or drops are possible to begin as soon as you start seeing some ocular discharge. Be aware though, the triple antibiotic that you can get at the store for skin issues is not valid to use for eyes. It needs to be pH balanced. The ophthalmic versions are pH balanced and sterile. Also, neomycin is one of the ingredients in triple antibiotic, and more people are moving away from neomycin because of possible allergic reactions and irritations. Terramycin is back on the market, and we're so glad to see that again. That's an excellent choice for early on eye infections. I have Vigamox listed here. It is a human medication. I call it liquid gold. It's a liquid and it's golden color. It's kind of expensive, I'll admit it, but if other treatments have not been working and the eye is getting worse and it looks like the kitten or the cat may require surgery and have that eyeball removed, Vigamox is going to cost a lot less than the surgery to do the eye removal. Plus, you've also saved the kitten's eye and oftentimes save the sight as well. I love Vigamox for eye issues, but be aware it is rather expensive. You might be looking at $100 or more. Caution with steroids. Please be sure not to use any eye medications that have steroids in them without having the eye examined first for ulcers. Steroids can prevent healing, so caution on those. Sucralfate is another human drug that's really gained, it's being used more and more in veterinary medicine all the time. It's very good for treating tongue ulcers, and if you start the treatment right away, as soon as you start to see the tongue ulcers, it's much more effective than waiting even 2 or 3 days. Most reports when we talk with other shelters who are using sucralfate say, yeah, if we start it right away, maybe it's 4 days, 5 days or so before the ulcer is completely gone. But if we wait a few days to start it, it's sometimes 7 to 10 days before we can get that ulcer under control again. And remember, when kittens have tongue ulcers, they're not going to want to eat because it's painful. And this would be one time that I'd actually say don't warm up the food, because the heat can actually make that tongue ulcer hurt a little bit more. Think about like if you've burnt yourself with an iron on the stove and you put your hand near heat again, how much you can feel the pain in that area. Cyproheptadine is an antihistamine. It may also have slight appetite benefits. Sometimes after the 3rd or 4th dosing, you see the kitten or cat start to be a little bit more eager, or at least a little more willing to eat. And as a last resort, this is kind of especially for adult cats who are very large cats, and it's day 2 or 3 and they have not eaten and you haven't been able to force feed them, but it can work with kittens as well. It's kind of a last-ditch appetite stimulant, and it's really a neat thing to see. It needs to be dosed absolutely perfectly. It's done with a veterinarian, and it's an intravenous injection. Too little, it doesn't really have much effect. Too much, the cat or kitten just wants to sleep. But if you hit that right sweet spot, they will want to eat really well, really fast. So you have to have the food right in front of them before you even start the injection. Because if you even take 10 seconds to walk across the room, take it out of the can, put it on a plate, and bring it back, you may have lost your window of opportunity. And this is usually done only once and can really be quite effective when it works to jump starting the cat or kitten into eating again. non-prescription medications are also available. There's saline nose drops that you can find at grocery stores and drugstores, and please be careful though that it's just the saline. There are many versions of these nose drops, and they have various medications added into them. I've got chlorpheniramine here in parentheses. It is an over-the-counter medication. It's an antihistamine, and it is helpful, but please be aware that it can have, just like any of these other drugs, can have interactions with other medications. So even though it's a non-prescription, it doesn't mean that you don't have to be careful with using it and using it with other medications as well. Again, L-lysine is something that some people choose to use on an ongoing basis for especially herpes issues. Now, all of that being said, wouldn't it be great if the kittens didn't get sick in the first place? And vaccines are going to go a long way to preventing these illnesses, or perhaps reducing the severity of the illness if they did contract it. UC Davis Shelter Medicine, the website is there. When you have a chance, please visit their site. They have excellent information on so many topics, but also including vaccination protocols. With shelter protocols, vaccination begins a little earlier than owned animals that are not at risk for as much exposure to disease. Shelter protocols are saying it can begin vaccination at 4 weeks of age for the rhino, calesi, and panleukopenia. Again, it's determining the weighing the benefits versus the risk, and the risk of contracting an illness in a shelter environment, even with excellent sanitation protocols, is pretty high. So that's part of also why these vaccines are given a little bit younger or a little bit earlier to shelter and rescue animals. Also be aware that there's a Heska intranasal vaccine for just the rhino and calesi. Now the main vaccines, it's recommended to use a modified live injectable, but on younger kittens, younger than 4 weeks old, we can still prevent some of the rhino and calesi viruses with vaccination with a Heska intranasal vaccine, just the rhino and calesi if they're younger than 4 weeks old. And many shelters report excellent results vaccinating kittens even 2 weeks old with the rhino and calesi 2 or 3 weeks old, and then their next vaccination would be the full injectable rhino, calesi, and panleukopenia. So please visit that site and get more information to save more lives. So as a review, again, let's try to prevent these situations from occurring. Let's prevent the illness. We'll do daily weight checks to let us know if something is happening and going on that we might not see externally yet on the kitten. Vaccination and parasite treatments on intake. The further an animal goes into a shelter and the longer they're there prior to vaccination, their chances of catching something just go up drastically. So ASAP on intake, and then quarantine the animal from the general population, especially these tiny bottle baby kittens that really are too young for any kind of vaccination. Keep them in a safe, separate place where they can be later picked up by a rescue group if you're working with them, and that they're not exposed to the diseases from the general population. Sanitation, of course, and then good nutrition, hydration, and probiotics all are very helpful for preventing these illnesses. Then again, if you do see early signs and symptoms of the illness, go ahead and start supportive therapies. Continue to look for what the actual cause of the illness is. Seek information and support from your medical director, your shelter coordinator, your volunteer or foster coordinator, veterinarian. Don't wait until things progress too far along. It's easier to treat early than to wait and let things get bad. Keep excellent records. Keep on learning like you did today by coming to this webinar and hopefully our other webinars. I told you I would tell you about little Monroe. This is a kitten that came to me. He was just a mess when he came to me. Right here he actually looks pretty good in this left picture. This was a picture to show the veterinarian the progress he was making. He had a terrible upper respiratory infection. His right eye was so infected and the conjunctiva so swollen around his eye that we could not even see his eyeball. He had a big gash in his side where his skin, like about a silver dollar area, was just flapping loose. He was just a mess. But this kitten was given a chance, and this was a Vigamox kitten, and we saved the eye, we saved his sight. Here is a picture that the adoptive family sent at his first Christmas, and although his eye looks shiny there, when you see him in person, you can't even tell there's anything wrong or that there was ever anything wrong with that eye. It just kind of shows up that way in pictures. And I know you guys have wonderful rescue stories as well. You are making a difference every single life that you save. These are some references and resources that are very valuable. Many of these listed on the left-hand side here are excellent universities. As I've mentioned already, UC Davis Shelter Medicine has pretty much any topic you need to research. They've researched it. They've done studies on it. University of Florida also is doing wonderful studies. And we're learning more and more every day, every week about neonatal kitten care. They finally are getting the attention that they deserve to save their lives. So keep learning. Medical world changes very quickly for these kittens. There's always new drugs and protocols. To that end, the last two items on the right here are veterinary drug handbooks. It's useful really to have a drug handbook so that you can look up the medication that's been prescribed. You can see how it works, what side effects to look for, possible interactions as well. Anything to keep yourself informed. You are the kitten's advocate. We'll have this sheet available on the Alley-Cat Allies website soon so that you can refer back to it if there's not enough time to look at everything right now. Again, we are Feline Outreach, Rescue, and Education. Thank you so much for coming to this webinar today. Thank you to Alley-Cat Allies for making this webinar series possible and for all the work that they do. If you have any questions, if we can help you out, please feel free to contact us. If you'd like us to arrange a workshop in your area, contact us about that as well. Our general contact information is listed here. My individual email address is here, rosemarie@felineore.org, and I thank you again.